Okay, so I'm going to check the chart. I'm going to walk in. I'm going to provide privacy. I'm going to wash my hands. Hello, my name is Maddie, and I'm going to be your nurse today. How are you?
Good, how are you?
I'm good. Can you tell me your name and date of birth, please?
Dominic Brand, 02/20/1998.
And what brings you in today?
Annual checkup.
Just an annual checkup. Do you have any pain right now?
Not at all.
Okay, so today we are going to be doing an abdominal and musculoskeletal assessment. Is that okay?
Yes.
Okay, so first I'm going to start with your abdomen, and I'm just going to inspect it. While looking at the stomach is round and flat. It's right for ethnicity. I don't see any bulges or masses or lesions. I don't see any distended veins or pulsations. And I'm just going to ask you a few subjective questions and just say yes or no, okay?
Yes.
What's your diet like? Are you on a specific diet?
No.
And what do you do for self-care?
Shower, put deodorant on, brush my teeth.
So you keep up with your daily hygiene? Yeah. Okay, and have you ever had any urinary problems?
No.
Do you pee? Do you have a consistency to go pee a lot?
Yes.
Yeah, and do you have any burning while going pee?
No.
Have you ever noticed any blood or mucus?
No.
When was your last bowel movement?
Couple hours ago.
Couple hours ago. And was it normal?
Yes.
There was no blood or mucus?
No.
All right, and are you on any medications?
No.
No? All right, so now I am going to, after inspecting, I am going to auscultate. And I'm going to auscultate the 4 quadrants in the stomach. This is the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. While listening to the 4 quadrants, I didn't, vowel sounds were present, and if they weren't present, I would listen for a full 5 minutes until they were. The reason being for me listening twice in each quadrant was to make sure that the sounds were equal and that there weren't any extra sounds. And now I am going to listen to your aortic, renal, and your iliac using the bell side of my stethoscope. All right, this is going to be the iliac. This is going to be the renal. Umbilicus is midline, and this is going to be your aortic. All right, so there was no bruise noted in the right iliac, left iliac, right renal, left renal, and the aortic. I didn't notice any bruise. Did you feel any pain or tenderness at all?
Not at all.
All right, and now I'm just going to check your temperature real quick. Skin is warm and dry, and now we're going to move on to percussing, and I'm just going to percuss your stomach and see if I hear any extra sounds. Right lower quadrant. Left lower quadrant. Left upper quadrant. All right, so tympani was noted in 4 quadrants. I didn't, there was no abnormal findings. And now I'm just going to palpate around the stomach. I don't notice any bulges, masses, or lesions. Did you have any pain or symptoms when I did that? All right, so I'm going to do a light palpitation and a deep palpitation, and let me know if you feel any pain at all. Light palpitation, right lower quadrant. Light palpitation, right upper quadrant. What's that for me? light palpitation. Left upper quadrant. Left lower quadrant. All right, now I'm just gonna push a little bit harder, okay? Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Did you feel any pain or tenderness at all while doing
Not at
that?
all.
Alright, so throughout the abdomen assessment, patient didn't feel any type of pain or tenderness. Skin color is right for ethnicity. There's no discoloration. Alright, now we're going to move on to the musculoskeletal. And I'm going to have you stand up for me. Go ahead, stand over there by the microwave and walk towards me. Alright, so patient's gait was steady. I didn't notice any wobbling or difficulty while walking. Did you have any trouble doing that?
Not at all.
Alright, so gait was fine. Go ahead and put your arms out and touch your nose. Alright, so finger to nose test. Patient's arms moved in and out equal bilaterally. I didn't notice any difficulties by doing that, and I'm just going to have you put your heel on your chin and rub it. Alright, do the other foot. Alright. Did you have any difficulties at all doing that?
No.
Alright, so while watching patient do that test, I didn't notice, it was smooth and steady. I didn't notice any difficulties while he did that, and that was the heel to shin test. And I'm going to have you sit down, and I'm just going to test your Msk reflex. Alright, so I'm going to feel around the foot. Ticklish.
Yeah.
Feel around the foot. Alright, so patient's Msk reflex was intact. Patient did have a reflex, as you could see. And then now I'm going to have you squeeze my fingers for me as hard as you can. Alright, so strength in both hands were equal bilaterally. One wasn't stronger, one wasn't weaker than the other. Now I'm going to have you hold my fingers. I'm going to push towards you and you're going to push towards me. Alright, now I'm going to pull towards me, you're going to pull towards you. Alright, so patient's upper strength is intact. And now I'm going to do, go ahead, put your legs out for me. Alright, go ahead, push. Push against my hands. Alright. Alright, did you have any difficulty doing that at all?
Not at all.
Alright, I didn't notice any difficulty. Strength was intact throughout the body. While looking at patient's muscles and joints, size and shape is fine. I don't notice any swelling, no edema or anything like that. And then I'm going to have you stand up for me. Go ahead and bring your arms up and swing them back. Patient's flexion and extension is intact. I'm going to have you put your arms out and down. Patient's adduction and abduction is intact. I'm going to have you bring your foot in and out.
In and out. In and out.
Alright, so patient's inversion and eversion was intact. Now I'm going to have you move your arms in a circle for me. So patient's circumduction was intact. So patient's range of motion was intact throughout the musculoskeletal assessment. And go ahead and have a seat for me. Do you have any questions for me at all?
Not at all.
Alright, well thank you for letting me do this assessment and we are all set today.
Thank you.